Hello, I'm Dr. Saritha Nimma, a general practitioner with special interest in diabetes. I did my specialist training and completed my MRCGP from UK. I made this video to explain the macrovascular complications of diabetes, how to recognize and manage them. I shall briefly explain about diabetes and I'll be doing a quick summary towards the end, informing you about the highlights of the presentation. The content here is distilled from research and I have not made up any of my own recommendations. It's impossible to cover all aspects of care for diabetes in such a brief video, and hence I would advise you to read further if you would like to know further information. I provided some links at the end of the presentation for those who are interested. And if you have any suggestions, kindly drop me a line and I'll be happy to respond. So let's begin. What is diabetes? It is a common condition, and the basic problem in this condition is that our body is unable to regulate and maintain blood sugar content. Mainly there are two types. Type 1, where the body produces very little or no insulin, and type 2, where the body makes insulin but is insufficient. Also, our body may become more and more resistant to insulin. Thus, the amount of insulin secreted is inadequate. Regardless, the blood sugar rises, and this high blood sugar is the root cause for all the complications. When we have diabetes, utmost care should be taken to address not just blood sugars, but also other associated risk factors like smoking, weight management, cholesterol, etc., because these other risk factors will compound the ill effects of diabetes if not well managed. What happens if I neglect diabetes? Well, it will invariably lead to various complications, both acute and chronic complications. Acute complications of diabetes mellitus are DKA, primarily seen in type 1 diabetes, and hyperosmolar hyperglycemic state, or HHS, previously known as HONC. The other category is hypoglycemia or low blood sugars. Chronic complications are divided into microvascular complications and macrovascular complications. Microvascular complications are the complications where small blood vessels are affected. When this affects eyes, it causes retinopathy, which can eventually lead to blindness. When it affects kidneys, it leads to nephropathy, leading to chronic kidney failure, and neuropathy, in which the nerves are damaged, in particular lower limbs, causing numbness and loss of sensation. The next category is macrovascular complications. This is something we'll be discussing in more detail during the rest of today's presentation. Here, medium and or large size blood vessels are affected by a mechanism called atherosclerosis. Cholesterol deposits known as plaque, along with stiffening of blood vessels and inflammatory process together, causes narrowing of the blood vessels known as atherosclerosis. There is clogging of blood vessels, leading to reduced blood flow to the organs and tissues. We all know that our cells and tissues are heavily dependent on oxygen, which is delivered to them via blood. Of course, lots of other factors also play a role, but atherosclerosis is the main mechanism by which the organs are damaged. So, let's look at some common examples how various parts of the body are affected. Peripheral vascular disease. It occurs due to narrowing of blood vessels in the legs, which leads to poor blood circulation and oxygen supply to muscles and bones. Over the age of 50, it can affect every third person with diabetes. It commonly affects legs more than arms. Along with reduced sensation, secondary to nerve damage, it can lead to formation of ulcers and death of the tissues in toes called gangrene, symptoms of peripheral vascular disease. For many people, there are no symptoms. Leg cramps in calves brought on by walking and relieved by rest is a typical initial symptom. Other common features are feeling numb or cold in the legs, discoloration of feet, non-healing ulcers in the feet. When it affects the joint coupled with nerve damage, it can lead to joint deformity called Charcot joint. Heart complications. Narrowing of the coronary arteries, which supply blood to heart muscle, results in cardiac complications. About 80% of patients with diabetes die due to coronary heart disease. patients with diabetes have 2 to 5 times higher risk of cardiac complications and death than those who don't have diabetes. There is higher prevalence of complications in young people with type 1 diabetes, South Asian individuals, and in people with poor socioeconomic status. Symptoms of cardiac disease are chest pain or arm pain or ache and difficulty in breathing, palpitations, ankle swelling, dizziness, and sometimes patients can be asymptomatic. Stroke. The mechanism is pretty similar to what happens in heart, but in stroke the blood vessels of the brain are affected. The common symptoms of stroke can range from transient symptoms, that is lasting only few minutes and resolving spontaneously, or they can be long lasting when it is full blown stroke. So let's see what you can do to avoid them. Are you ready to unlock this potential? Thanks to extensive research, we have enormous data about how to prevent and manage complications. Each person's care is individualized. However, you should know the basic treatment strategies. Structured education will enable you to understand your condition in a better way, and your physician will help you with this. Structured education is theory and evidence-based, quality-assured program delivered by trained educators. The main aim is to support you and your family members to understand the skills of self-management of diabetes. We all need to understand that every patient with diabetes has to follow some of the basic principles to improve their quality of life, reduce complications, and improve survival. So let's begin with the lifestyle changes. Lifestyle changes, and it's a biggie. Who said that lifestyle changes are easy? They can be extremely difficult, but, and a big but, if you can achieve it, there's nothing like it. This will be one of the biggest favors you can do to yourself. You don't need to change yourself completely. Changing to healthy habits and maintaining them is the key. The first step among lifestyle changes is eliminating smoking. Don't just stop, but eliminate smoking. Also, discourage those who smoke around you. How does smoking cause this menace? Well, smoking causes release of inflammatory chemicals called cytokines, increases in oxidative stress on the cells, and also causes release of various other chemicals, all of which together result in initiation and progression of atherothrombotic process. To put it in simple terms, smoking causes development of blockages in blood flow, thus resulting in tissue damage and death. So what can you expect if you stop smoking? Do you know just by stopping smoking you will increase your lifespan, reduce your risk of having a heart attack or stroke, decrease the risk of developing peripheral vascular disease, and decrease the risk of developing erectile dysfunction. So don't just stop, but eliminate smoking. You will notice benefits within months of quitting smoking. Regardless of how long you've smoked, if you stop, you can expect both short-term and long-term benefits. Various medications are available to help you with quitting smoking. However, e-cigarettes use is still controversial and is not recommended by American Diabetes Association. Now, next step in lifestyle management is weight management. Smash that weight. Lose it. Fat or adipose tissue contributes to the majority of extra weight in overweight or obese people. This fat does not allow insulin to act efficiently and results in insulin resistance. Most patients with type 2 diabetes have some degree of insulin resistance. As we exercise, we start to melt away the fat, and thus the insulin resistance starts to improve, which in turn leads to better blood sugar control. Losing weight also helps with lowering blood pressure and cholesterol, both of which are required to prevent long-term complications of diabetes. A recent study, direct study published in February 2018 in Lancet Medical Journal have some astonishing results. People with type 2 diabetes who had significant weight loss of up to 15 kgs resulted in disappearance of diabetes. Now, that's profound. In some instances where lifestyle changes and diet haven't helped with desirable weight loss and weight remains a cause for concern, medication like orlistat may be prescribed by your physician to help you to reduce weight. Bariatric surgery may also be used to help weight loss and prevent complications of diabetes in a select group of patients. The next step is to keep moving. Exercise. Aim for at least 30 minutes of moderate intensity physical activity per day. This should make you breathe a bit faster, and you should notice your heart beating a little faster and will make you sweat, but not severe enough to make you gasp. Regular exercise will reduce blood pressure, cholesterol, reduce weight and blood sugars, as well as keeps your heart muscle healthy. It improves blood flow to the heart. It's medically proven that regular physical activity will reduce heart attacks and strokes by 35%, risk of developing type 2 diabetes by 50%, and up to 30% risk of premature death. When you exercise, your muscles are hungry for glucose and they consume this, thus lowering your blood glucose. Exercise also helps to reduce any insulin resistance, which is a common finding in people with type 2 diabetes. Exercise independent of weight loss will help to have a better glucose control. The next step is to have a good diet. You need a healthy and balanced diet. There are many diets recommended for diabetes, and also there are many fad diets available in the market. The basic requirements for a healthy weight losing diet are to have low carbohydrate intake, cut down on snacking, reduce alcohol intake of no more than 14 units per week, avoid refined and processed carbohydrates, choose whole grain foods, control your portion size, and include protein and a small amount of fat in your diet plan. As a part of structured education program, you will have further information about diet and may need consultation with your dietitian. Calorie restriction, reduced fat intake, eating foods with low to medium glycemic index helps in reducing your sugar level. You can follow the link below to know your Eat Well guide, glycemic index, and carbohydrate counting, which are useful tools to lower your sugar levels. However, it is not a replacement to visiting your dietitian and to your physician's advice. You should also have annual health checks. You should consult your healthcare professional at least once a year. During this visit, you should have eye examination to look for retinopathy and cataracts, foot examination to look for nerve damage and circulation problems, blood pressure and weight check, blood and urine test to assess for any kidney damage. Your doctors will also look into your lifestyle measures and check your blood sugar control. The main aim of this review is to assess the risks and reduce the complications of diabetes. Next step is blood sugar control. Good control of your blood sugar can prevent or delay cardiovascular complications. The aim is to maintain blood glucose levels as close to normal. However, intense blood glucose control with treatment can result in dangerously low blood sugars. Do you know that controlling blood sugars and reducing HbA1c by 1% will reduce the risk of myocardial infarction or heart attacks by 14%, heart failure by 16% in patients with type 2 diabetes, and peripheral vascular disease by 43%, resulting in lower number of amputations. Association of glycemia with macrovascular and microvascular complications. So what is HbA1c? It is a blood test which measures your blood sugar control over the last 3 to 4 months. HbA1c is an internationally used standard blood test for any diabetic patient. American Diabetes Association recommends checking HbA1c levels at least twice a year for those who are meeting target levels. What should be your HbA1c target? One thing I need to make it very clear, there is no fixed target. Each patient has different needs, hence the targets vary. It is something that has to be discussed and agreed with your doctor. However, in patients with type 2 diabetes, most international guidelines recommend to maintain HbA1c between 6.5 to 8%, and in patients with type 1 diabetes, international guidelines suggest the target to be less than 6.5%. Kindly note that this will change based on your other risk factors as well as risk of low blood sugars. How to achieve your target HbA1c? Now, losing weight, following a healthy diet, increasing physical activity helps to maintain your HbA1c at the target level. With the above measures, if your target HbA1c is not achieved, then your doctor will consider starting medication. There are various forms of medication, and these are tablets, injections, as well as continuous insulin infusion pumps. In type 1 diabetes, insulin is a mainstay of treatment, whilst in type 2 diabetes, treatment is usually with tablets. In type 2 diabetes, insulin may be added if target HbA1c is not achieved. Self-monitoring of blood glucose with needle prick and glucometer is a well-known component of care in monitoring blood sugar levels in those with type 1 diabetes, insulin-treated type 2 diabetes, and in those who are at high risk of developing low blood sugars. A diary of such recordings is of immense value to your doctor, especially when the doctor is considering medication review. Those who suffer from repeated severe low blood sugars can be offered continuous blood glucose monitoring. Now, the next step is blood pressure control. High blood pressure is a major risk factor for cardiovascular disease. Patient with diabetes has double the risk of developing high blood pressure. NICE Guidelines UK recommends target BP of below 140/80 for patients with diabetes and even lower if there is a history of cerebrovascular damage like stroke. The deadly combination of hypertension and diabetes is associated with 57% increase in adverse cardiovascular event. HOT study shows a 51% reduction in cardiovascular events when diastolic blood pressure was less than or equal to 80 mmHg. Other studies have shown that when you reduce the blood pressure by 10 mmHg, the risk of heart attack is reduced by 11% and deaths due to diabetes by 15%. Now, how to control blood pressure? Hypertension in patients with diabetes should be treated aggressively with lifestyle modifications like diet, exercise, stopping smoking, etc. Sometimes medication is required. The key is to achieve and maintain the target blood pressure. Now, regarding cholesterol, what is cholesterol? These are fat particles circulating in blood. We have HDL, usually known as good cholesterol, LDL, VLDL and triglycerides, all of which are commonly called as bad cholesterol. As LDL raises or HDL falls, cardiovascular risk starts to increase. As we discussed before, bad cholesterol contributes to plaque formation. I have some good news though. If you start to take some steps to address high cholesterol, you can halt and also stabilize the plaque that's already formed, thus halting the atherosclerosis process. What can you do to tackle high cholesterol? Similar to other risk factors, cholesterol should be addressed from various fronts, that is, lifestyle changes, stopping smoking, losing weight, increasing physical activity, and of course, medication. Usually, medication is used to complement lifestyle changes and or when other measures have failed. Not everyone will need medication, and your doctor may use risk score calculator known as QRISK2 to check if you will benefit from medication. Medication for high cholesterol, the most commonly used ones are statins. Usually they are well tolerated, but some may develop side effects like muscle cramps. If so, seek your doctor's advice immediately. For every 1 millimole per liter reduction of LDL cholesterol, the cardiovascular death and heart attack is lowered by almost 25%. So just imagine, by whatever means, if you can reduce your bad cholesterol, you're reducing your risk of having a severe heart attack or stroke by almost 25%. Now, the next one to discuss is aspirin. Lots of my patients who have diabetes ask me if they should take aspirin. Aspirin is recommended in people with diabetes who have coronary heart disease. Platelet inhibitor therapy, which is aspirin or clopidogrel, has shown a reduction of 31% further heart attacks, 42% non-fatal strokes, and 13% cardiovascular mortality. Now let's summarize today's content. Diabetes is common. There are two types, type 1 and type 2. Type 1 is mainly treated by insulin. Type 2 diabetes is multifactorial, that is, multiple factors play a role in its development like lifestyle, weight, etc. Lifestyle interventions have a major role in the management of diabetes. The main problem in diabetes is uncontrolled blood sugars, which leads to a lot of other complications. High blood pressure, high cholesterol, smoking, excess body weight, poor diet all compound the ill effects of diabetes. Atherosclerosis is root cause for most complications of diabetes, and all the above factors facilitate atherosclerosis. Each of the above risk factors should be individually addressed to have significant effect on the overall health status and to avoid complications. I developed ABCDE approach for you so that it is easy for you to remember the aspects of diabetes care. A stands for annual health checks and aspirin. B stands for blood sugar and blood pressure control. C stands for cholesterol management, compliance with medication. D stands for diet and weight loss. E stands for exercise, eliminate smoking, and education. I hope this video was informative, and if so, kindly share it with your near and dear whom you feel will benefit watching this. Also, please like the video by clicking the like button below. I have listed all the necessary links in the description below for your reference.